privilege in welcoming Professor Dr. J.A.Jayalal, MS, FASIS, PhD in front of you. He doesn't need introduction to the I.M.A.Ns, but for your sake, he has served almost every position in the state level as its CGP, State Secretary, CGP, National Secretary, then as the State Secretary, then as the National Vice President, subsequently ending up as the Honorable immediate past National President. Welcome to you, sir, and over to you.
Thank you, Sridhar, for the introduction, and beloved and distinguished leaders of Indian Medical Association, my distinguished chairperson, and my dear children. I'm extremely happy and delighted to be with you at this moment. It is a time for us to be getting cheers because one of the wonderful initiative by Dr. Abul Hassan to have the World Young Doctors Day celebration. And not only young by age, all of us feel young. So all of us join together and celebrate this World Young Doctors Day. So I'm today going to talk to you on some of the academic and the core values or the core ways and how we are going to improve in our life. I'm sure as a medical fraternity, all of you are excellent in your academic career. That is why that you are here in this academic event. That is why that we are having that is a JDN doctors across the country from Haryana. Dr. Haran has come, Dr. Sangal Trivedi and Venkatesh from Patna and various people has come here because all of you has been excellent, academically excellent. And the one topic today, if the whole of my talk is going to depend upon the triceps concept, because the triceps, as you know, always it is one of the best thing we use in the muscle. The triceps has the 6 component. One is the teamwork. That is what going to decide that how a doctor is going to be a better person. It is individually that we will not be able to do much greater work, but collectively as a team, together as a team, and we will be able to achieve anything. The term I always use as a team is TEAM, together everyone achieve more. So as a doctor is involved, as a medical student involved, maybe individually you have worked for your scoring high marks, individually you are working for getting your good NEET PG score, but after becoming a doctor, it is not an individual success, it is always a team success. So you need to have a team effect. The second most important thing which we need, as a respect which we need to create, as a skill which we need to create is a respect. Respect for you, respect for your team, respect for the colleagues, respect for the entire society and the people whom you are going to see. And I personally believe, if as a medical students of this era or the youth of this era, because of the socio-dynamic changes which we are having in the society, the concept, the word respect, that we are not fully understanding, and it is need to come from our own heart, and we need to respect, and then we need to have that. And I will be going to talk to you about the integrity and how best we are going to talk on that integrity, compassion, excellence, and the patient-centeredness. We know as a doctor, we are shifted from the education pattern, academic pattern. Now we are having a competence-based medical education. So every doctor, every medical student is expected to have a goal. To achieve the goal, he has to have multiple roles. To achieve the roles, each role, he has to have the multiple competency, objectives which we are doing. I am very fond of this definition of the Indian medical graduate. It is not that you are going to call you as a doctor, but you are going to have this great definition given by the Medical Council of India, and now it is reiterated by the NMC also. I think this every one of you, when you are want to develop you as a good doctor, and you need to mesmerize this into your heart, or memorize into this heart, and imbibe into this activity, so that it is an Indian medical graduate. You and I are need to have the knowledge, the skills, the attitudes, the values, and responsiveness. These 5 things, the Indian medical graduate, you are expected, and which you will be acting as a primary care physician, but the international perspective of that. And as for achieving that goal of the Indian medical graduate, it is always expected that a doctor has to have the 5 roles he is playing. One of the roles is a clinician. Remember, at all the 5 roles as an Indian medical graduate, what the medical council or the NMC is expecting on you is only one role is a clinician, but the other 4 roles are more important. Indian Medical Association is organizing this meeting to infuse that into your mind. It is not only as a clinician, but we want you as a professional. And exactly what is the professionalism, we will be looking to see that. And we also want you as a leader. It is not only a one person sitting in a one part of the country, but we want you as a leader of the medical fraternity, where we are going to lead an entire team of the healthcare for imbibing a magic change in this country. What the country needs to give, what the country gets to get, and all that you are going to make. And you has to be a good communicator, not only you having a person with a cognitive skill, but also will the person will be able to communicate with the person, and we will be always able to hear as a person who is going to lifelong learner, and every day, even after my 50 years, 60 years, or 80 years, that you need to learn. So these are the 5 comprehensive load, and we need to see to that. And our focus, our area has to be, we need always have to be multiple activities. I said that it's one of the most important thing, that you need to be a professional, and that is most important thing in our life. And what we are going to call as a professionalism, or what we are going to call you as a mere doctor. And it is not that what you are going to call you as a professional, it is the society is going to give you that what the professional has to be, and how you are going to behave into that. And professionalism is not just a knowledge, it is not that you are the skills, it is not that how best you are a good surgeon, but it all depends upon how your attitude is going to be, and how you are going to take your patient at your level, how you are going to consider the medicine as. Is it that you are seen to that as a source of income of money, or are you able to see that you are able to give the happiness to someone else? And that attitude is going to make you as a professional. And what we today want you to make that positive attitude, the attitude of compassion, the attitude of sympathy or empathy, an attitude of love. And that is what is going to make you as a good professional, which every one of us has to take the earth. And it is not that what you do, it is that how you are going to do. I can do a surgery very effectively, but if I am going to do the surgery with the care, concern, and compassion for the patient, it is not just because it is feasible for me to do, but just because that it is going to be beneficial for the person. And if you are going to do, that is going to be the professional. So the professional, you need to have an attitude that how you are going to do that. And you need to have that, develop a skill that why you are doing that and how you are doing that. And every procedure, even if you are going to do just a knee-jerk reaction test, and you can do it with a smile in your face and the compassion in your heart, but at the same time you can do it with a heaviness at your face and with the arrogance in your face also you can do. So as you talk about the professionals, that you need to have a develop that how you are going to do and what you are going to do. It is not the level that you are going to give. Someone going to see you. Hey, this is a doctor going to, he is so compassionate doctor. A person looking at you should see, yesterday when I was suffering in the bed and this person came and helped me. So that kind of attitude that we need to develop into that. A professional status is not the coat which you wear, but the person, other people are going to talk to you about that. I am not going to talk much on the professionalism, which all of us are very, very much aware of that. It's the hardest conviction to get into the mind of the beginner. Is education upon which is engaged is not a college course, but the lifelong course that we are going to learn onto that. And this is a picture I have just shown to you. And as a professional and a doctor, there is a lot of difference. And this is a question, there is a 6 bottles. These 6 cups are arranged. 3 cups with a brown color, probably we can think as a Coca-Cola. And the 3 cups are empty. The question in front of you is, you are allowed to take only 1 glass up, but you should make the entire glass in an alternative way. There are so many ways you can do. You are allowed to take only 1 glass up, but taking 1 glass, and if you can take the water, it comes in an alternative way, and that is called as a smart working. The best person who did is, he took the water in the second glass of the Coca-Cola water, pour that water on the fourth and the sixth one, and then this bottle becomes empty. So you become as an alternative way it is going on. I'm not showing the video. Because that why I would say is a professional and a doctor is not that what you do and how smart you are doing, how best you are doing is going to be important for you. Don't just do work hard, but just doing by hard working that. So if you can take one good out, and definitely we will be able to make an alternative. So second, I talked about the respect, which is what that most importantly we need to do that. And please, my dear beloved youngsters, as I have going through and moving around many medical colleges and even my own medical students, what I feel personally, a skill which every one of you to develop is a respect. Is whom you are respecting is a different, but the mind of respectfulness to others, mind of respectful to the patient, mind of respectful to the compounder or the staff nurse who is going to help you to learn your skills and learn your attitude, is that one skill which I personally believe is going to help you a lot in your life. Everyone, whoever you are going to come across in your life, please remember everyone is unique. The God has given the talent to everyone in a different way. So please try to have a respect is a glue that holds teams and organization together. If your hospital is not working properly, if your institution is not working properly, the basic reason for that is there is no respect for each other. And if you can develop the respect for each other, is the respect for the professors, the guest speakers, the cadavers, the institution, the patient, and patient confidentiality, all that then you do, definitely that you will be able to do. I always used to say it is not that so professional, as a professional, that you need to have all these character is a teamwork. Already we have talked about the concern and welfare for the patient, which you need to develop. Integrity and trustworthiness you have to develop. Self-care and self-growth, it is also important that which we are going to develop. Compassion, respect, I already talked to you that. This is another two words I want to bring to your conclusion, the humanism and professionalism. And these two are look same almost. If there is a humanism without professionalism is no use. Similarly, the professionalism without humanism is of no use. Humanism is your inherent character. Humanism is your inherent behavior. Even no one is seeing you. No one is looking at you. That the amount of kindness what you are having is going to show as a humanism. But the way in which you are going to exhibit your work, it has to be the professionalism. So humanism denotes the intrinsic set of deep-seated convictions about one's obligation towards others. The professionalism is what you are going to exhibit others. So always in the life, if you can be a good professional, but without humanism, if you become a professional, there is no point and there is no meaning in that. So as a young medical student, the skill which I want you to develop is a humanistic attitude. Wherever you are, whatever you are, please try to learn this human attitude. Do not consider others as a mission. Do not consider others as a people which do not have the feelings, whether it is a patient who is going to die, even the patient who is in a sick bed, whom you are going to do the amputation, believe that he has a human heart, he has a human feeling, he has a human innate. Even someone in your casualty coming and scolding you, coming and fighting with you, please remember he is also a human being. And if you can show that humanism in your attitude, if you can have that human attitude in your mind, someone has the courage to talk against you in your face, I say he is a great human. And we need to have that respect. And if you can respect the humanism, definitely we will be able to do that. And humanism is deep down in your heart, and we need to develop that. Sometimes we can pretend to be a good professional. Sometimes we can act as a professional. But if you do not have the humanism, it will be very difficult for you to come out on that. What we are today, a skill which we all have to develop, is that at any point of time, and we shall not disclose the in public the failures of our own doctors, or in public talk something against our doctor. One of our great leader, Dr. Agarwal, often used to say, even if you are going to discuss with your wife, do not talk bad about a particular doctor. And if you can have that habit in your mind, and at any point of time, I will not talk bad about any of the doctor, and definitely that you are going to learn the good humanism and professionalism. Friends, we have a God has two eyes in your heart, and which you are going to see others, and what your eyes see we always used to say, if the mind do not know, the eyes will not see. If you are going to see the mistake on others, that means something is embedded in your mind is only the mistakes and wrong things. And if your mind is full of good things, I think you will only see the good things, which is that every human being, every doctor, however bad he is, he has something good in him. So always try to have that concept in your mind when you have. I do not want to talk much on the ethics because it is every one of you know. But one thing which we want to emphasize on ethics, ethics and law are little different. Law, only when you make some mistake, you are punishable. Ethics, even if you think of that doing, if you are thinking of doing something harm, even think of doing something bad to your colleague, even think of talking something bad about your person, and that definitely that you are at a bad stage. Please develop that. Don't try to talk about the bad about that. The three words which I want to talk to you is these four words on ethics, three skills which always we need to do: autonomy, beneficence, maleficence, non-maleficent, justice. Whenever you talk about the four words, and this is the four are important, I wish and hope, and as you develop an ethical skill, autonomy, respecting the patient, beneficence, doing always good, maleficence, do no harm, always do prima nocere, and justice, whatever is possible, try to do with what is best in you. And you can't escape by saying that I do not know the law. You are last one person. When somebody has filed a case on 302 against Archana Pate, and she has to commit a suicide because she was not aware, as per the law, no doctor can be punished or booked under 302. So when you as a skill, not only the medical knowledge, you should always have something you should develop in your life to have that the knowledge about the skill. Friends, I know that the time is short, but I just want to impress upon you. This world in which we are living is a wonderful world. We have a lot of good people to there, a lot of people to support us, and every day is a day that if you are able to develop at least one new skill or 1% improvement in your attitude, 1% more on your compassion, 1% more on your altruism, and that is going to be the great day. Knowledge is now available in a computer or your cell phone at every time. But altruism, compassion, empathy, skills, which every day we need to strive hard to develop the human attitude, develop that skill, so that we will be able to serve the society. I know the future of our country is on you. The future of the country is dependent upon my young colleagues. And if I can see you as a humanistic professional, altruistic professionals, I'm confident that the future of the India will be one of the best for our healthcare delivery in our country. Thank you very much for this opportunity. May God bless you all.
Talking of ethics, I request Dr. N.R.T.R. the Honorary State Secretary of I.M.A. Tamilnadu, being himself a member of the Medical Council of Tamil Nadu, ethical man, to say a few words of remarks.
Well, President, Chairman, and Jayalal sir, that was an amazing speech. As usual, you have your style, and it was delivered very well. He's maybe put your entire life into a nutshell and hammered it into our heads. That's what he's done for the last 20 minutes. Maybe given more time, he has he would explain it even more. But that was again very inspiring, sir. Thank you for this amazing speech and amazing input that you've given for the young crowd here. Thank you, sir.
Thank you so much, sir. Once again, I request Dr. C.N. Raja, National Vice President of I.M.A. HQ, to please come forward to the honors for Dr. Jayalal. We'll put your hands together for Dr. Jayalal. Everybody, please. And I request Dr. K. Prakasam, past National Vice President of Indian Medical Association, to please come and join us on the stage. Thank you so much, Dr. Ramakrishnan, for joining with us. We'll put your hands together for Dr. Ramakrishnan. Everybody, please. And thank you so much, Dr. N.R.T.R. Thiagarajan, sir, to please join us with today. Thank you so much, Dr. S. Karthik Prabhu, to joining with us today. We'll put your hands together for Dr. Karthik Prabhu. And last, I will thank Dr. Aravind Sami for joining with us today.